The practice goes back certainly way before my time to about 1940 when Dr. Pitts was one of the first neurosurgeons in North Carolina that started this practice.
We've really seen the practice evolve, but when we look at the big picture and we think about how in 1940 where there wasn't really specialized neurosurgery, it was just the beginnings of specialized neurosurgery, and then to see that evolve over a period of 75 years into a practice that has upwards of 30 surgeons and are able to provide treatments for both non-surgical and surgical conditions really across the board in both brain and spine. It's been very exciting for me, and research has played certainly a big part of that as well.
Carolina Neurosurgery and Spine Associates is a unique practice in that it has a very good blend of a variety of different sources of neurosurgical knowledge. We have the size that we can continuously introduce new and innovative techniques and technologies.
We've had many physicians that have been involved in development of techniques and of equipment, and so we pride ourselves in trying to be innovators.
Patients have this opportunity to know that when they come here, they're going to have a thorough assessment, number one. They're going to have up-to-date and all the state-of-the-art imaging studies available to them.
We have the full complement of services in terms of neurosurgical, physiatry, physical therapy.
I think that we're increasingly recognized as a leader, both in advancing the science of medicine and neuroscience specifically, but also in the paradigms of care, in advancing quality of care, and doing the other things that are becoming so important to us as a society and a healthcare system.
Our group of physicians are leading the nation in outcomes measurement. Patients who undergo surgical care in our group are followed closely, their voice heard throughout a year or two after surgery so that we can understand what works best in which patients.
We've got representatives at each of the levels, each of the most important sort of spokes within our specialty, political, technological, educational, all of those things we feel like we've got covered, and so we feel like our group is certainly well positioned for the future, hopefully having that combination of talent that we can allow ourselves to be successful even going forward into this new era of healthcare change.